is AJ Clevenger. I'll be showing you how to do a shoulder. We got various positions. We got the neutral position, rotation, and we got the external rotation, and we got the internal rotation. We also got the Y view of the scapula, and we also got the PA axial shoulder. Alright, so for the technique that I would use for a shoulder for the first three shots, which will be the neutral position, the external position, and the internal position, I would use the technique at 75 kVp at 10 mass. And for the lateral Y view, I would probably bump up the mass since we're shooting through more density. I'd probably put it at 16. And for the last shot, the auxiliary shot, we want to make sure that we come from wall bucky to tabletop, because we're shooting on top of the table there with the grid. So I would probably go at 75, leave that at 75 kVp, and 10 sounds good. 10 mass, and we'll make sure that your focal spot size is small as well. And that concludes our technique. Alright, so in order to shoot this shoulder, we have to set up our room before we bring in the patient. I have my tube detented along with the wall bucky here. I also got it at 40 inches SID. I also got a 10 by 12 cassette put inside the bucky here, landscape wise. For landscape wise, we're going to do it for the neutral, external, and internal rotation. And then we're going to put it back in the lateral position when we do the scapular, wide view. Alright, so now we're going to bring in the patient. Alright, so what you want to do before the exam, you want to make sure that you double ID them, ask them the full name, the birth date. Sir, what is your name?
My name is John Rivera. Birthday is April 3rd, 1991.
Alright, and if they're male, or sorry, if they're female, you want to ask them to see if they're pregnant or not. Sir, are you pregnant? Nope. Okay. And another thing too, you want to check on history. Sir, do you have any why are you here with your shoulder injury?
No, I was being awesome and playing sports. Played a little too rough there, so I'm getting checked out.
Okay, so you're playing rough sports. Alright, so we got all that done with. We also got to put a little apron on here. Got to protect his lowers from radiation. Alright, sir, we're going to have you go ahead and step in front of the bucky there, facing me.
This monkey?
Yes. Sorry, roll forward. Okay. What we're going to do is we're going to put the 10 by 12 inside. Then we are going to fix our vertical here. So what you're going to do is put the cross here, the CR right. It's 1 inch inferior to the coracoid process. So it looks like we're going to move him a little bit over towards that way. Another thing too, is you want a little bit light over his shoulder as well, about 1 inch. Alright, and then another thing too is you want to put your right marker, since his right shoulder is the affected side. So right there above. Alright, so for this shot here, what we're going to do is we're going to put his arm down, and we're going to shoot it into a neutral position rotation. Alright, and then take the x-ray. Another view is the external rotation. Extend his hand out, palms open. Make sure we're detented perfectly. That's right. And now we're going to do, what we're going to do now is we're going to do internal rotation. Oh, sorry. Don't want to touch the patient. Switch on the affected side. Alright, so now we're going to be doing the Y view. We want to see the scapula at a lateral Alright, so in order to do this, we want to make an imaginary line. So what we want to do is get the AC, look for the AC area, right here somewhere. And then you want to get the, put your other finger to the medial border of the scapula. And what we want to do is have the patient do like a Star Trek Enterprise position there. Right arm over his shoulder there. And this imaginary line will go perpendicular with the ball bucket here. So go ahead and move that way. So it's perpendicular. There you go. So he's pretty much perpendicular here. And in order to get the CR, and then the CR enters his right shoulder, kind of like AC joint 1 inch inferior to it. So then my private raises up just a little bit. Alright. Alright, then we want to also place the right marker. Left marker too. Right. We're going to place a right marker on there. So we're going to bring the X-ray tube down to 40 inches. And then we're going to bring the patient right on over at the end of the X-ray table here. And we're going to use a grid with the 10 by 12 cassette. And we're going to have him lean over with his right arm over towards the middle there. There you go. And what we're going to do with the tube here, we're going to angle it 5 degrees distal or cotton. And then we're going to move him over just a little back a little more. There you go. And now we're going to center this CR over the soft tissue of the deltoid, right over here, so you're moving back a little bit. Sure, move that. Alright. So we got a 5-degree angle there. Want to make sure that we have the right marker on, so when his right side is affected, right in there. Alright, so the technique I would use is 70 kVp at 10 mass. Now after each exam that is completed, we will bring the cassette over to the reader. We will find the barcode in back of each cassette. We will scan the cassette. Then once the beep, we will put the cassette inside the reader. Then what the reader will do is bring up the image up on the monitor. Then from there we critique. Alright, now that we're finished with the exams, we will now go to the critiquing. We will start with the neutral rotation. Now what you want to see here, you want to make sure that you have the greater tubercle, which it is partially superimposing the humeral head. We want to see a little bit of overlapping of the humeral head over the glenoid cavity, and we also want to see that the humeral head is partially in profile. Okay, now we will critique the internal rotation. Here we see a really good collimation. We also see the right marker, because that's what we shot. It was a right shoulder. Internal rotation, and what we want to see mainly is that the lesser tubercle is pointing medially towards the body. We see a little bit of humeral head in profile, and that's about it for internal. In this shot here, we have the external rotation. What we want to see here mainly is the greater tubercle, that it is on the lateral side of the body. It's pointing towards there, towards the lateral side. We also see that the humeral head is in profile. And let me see here. Take a little closer look here. We also see that the humeral head is slightly superimposing the glenoid cavity. What else do we see here? We have good collimation, and that's the external. Okay, this radiograph here is the scapular Y view. What we see here is great collimation. We see that the right marker is placed, and for anatomy wise we see that the acromion is free of superimposition. You see it a little bit better here. We see that the humeral head is completely superimposed of the glenoid cavity. The reason why they call it a Y view is because the scapula is in a lateral view. What else do we see here? And we also notice that there is no superimposition of the scapular body over the bony thorax. And what else? I think this this picture is really good collimation. And for our last critique here, we'll be viewing the auxiliary shoulder shot. And I apologize for the actual image here. It's kind of hard to see, but we can see the humeral head and the actual the whole humerus here. Let me see here. Alright, so what we want to see is the humeral head projected free of the coracoid process. Almost see it here. We also want to see the articulation between the head of the humerus and the glenoid cavity. We want to see the acromion superimposed over the posterior portion of the humeral head. And we also want to see that the shoulder joint is there. And that concludes my critiquing.